Alright, today we're going to be talking about how to determine what type of back pain you have without actually diagnosing you as such. You can safely sort of like put people in one basket or the other basket, and the two baskets are extension related low back pain or flexion related low back pain. So extension related low back pain would be someone that gets pain from overextending. Usually it's a posture that has their bum stuck out and the knees are hyperextending. This person will jam up the facet joints quite a lot, and I have a lot of pain from doing things on Swiss balls upside down, and they'll hyperextend their back too much. So that's the one side of it, and I'll go over the stretches and the exercises you would use for that. On the flip side of that is the flexion-related low back pain, and flexion is this sort of low back pain. This one is the one that disc bulges are highly associated with. So in the gym environment, that'd be like doing deadlifts badly, or in the real world, like picking something up like this, or usually it's tying your shoelaces or picking a pen up is usually when people do it. And this one has a series of stretches and exercises that are exactly the opposite to the extension-related low back pain. So basically the person who's flexion-related, who's got pain from this, needs to do all the things that has turned the extension-related person, all the tight areas need to be sort of transferred to the other guy and vice versa. So I'll sort of very quickly, there's a lot of parts to this, but I'm sort of trying to simplify something for people so that you can sort of start on stuff straight away, and the sooner you start, the more effective it'll be in the long term. So it's not just getting rid of the pain in the short term, you're going to get rid of it forever, but you have to start now and you have to do it all the time. So it's sort of the position of relief is giving you a lot of clues here. So let's start with the extension related low back pain. So if their back gets into soreness every time they arch it too much, and they feel good from doing this sort of thing, it's these sort of stretches that you need to be doing. All right, so doing a stretch as such, like pulling yourself into a ball and trying to roll, that would be an excellent stretch for that person. The muscles that really are pulling the spine into that extension are usually the hips. All right, so it's usually the hip flexors and muscles on the side and foam rollers and things like that we would use at times. And the back extensors themselves is what we call lower cross syndrome. So this area on the bottom half on the top half of the pelvis here, is sort of like, and the bottom half is sort of working in combination with the back extensors above the pelvis, and they're sort of both pulling the pelvis into an anterior tilt where it tilts it forward too far. So knowing that, it's very effective to stretch the hip flexors. A lot of people we will see, and I might get Melissa in a second and I'll give you an example. We see like them stretching hamstrings because the hamstrings appear tight, when it's actually the hamstrings are not tight, they're more taut. All right, so I'll give you an example of that in a minute, but that'd be like a hip flexor stretch. Rolling a Swiss ball behind us and doing a quad stretch would be effective, and obviously this would be back extensor stretch. All right, so let's get Melissa in the video here, and I'm going to show you when she lies down on her back. An example of something, and Melissa's got like Piriformis Syndrome, sciatica pain in this left leg, so this is not very comfortable for her to do this, right? So, and you can see like she's telling me that's enough, that there's a lot of tension in her hamstring, so it appears that it's a hamstring problem, but it's not, it's like a sciatic nerve problem. And half of her problem is her pelvis is not moving, it's sort of frozen. If I get her to like get her back to flatten right out on the ground, can you see how much the leg keeps going now? So when she's relaxed, because her pelvis, she's so far anterior tilt, you can see in the video here how much gap between them. That's her normal position. So she is someone who has extension-related back pain, and when her leg comes up, she doesn't have enough movement through her hip. So if her abdominals were strong enough, it would actually take her leg into more of a normal sort of length tension. She's still got a bit of tension there, but it's a lot better than it was. All right. And so that's an example of an extension-related low back pain. Now, the flexion-related low back pain, the guy who's doing this sort of thing, he needs to actually flip over, if Melissa was this person, and do what's known as the Mckenzie Stretch. So this person needs to get the tilt. So what Melissa has too much of, the flexion-related person needs to do more of this. And this is usually for a person with disc bulge, this is the only position you can get into without pain. So if you're watching this right now and you've got it, you'll know exactly what I'm saying. All right, so there's a lack of strength here, and the tight area is actually the abdominals and the hamstrings and the glutes. So the area that we don't stretch for her, we do stretch for you. So a hamstring stretch for that person is essential. All right, so doing both a straight leg and a bent leg stretch, and stretching the glutes as well. All right. These are just some of the exercises that we would use. Watch some of the other videos that are coming up, because this is quite a big topic. I'm going to try and chunk it into pieces, but the main thing to get from this video is to know where to start. All right, so either you're extension related, so you start to work on the muscles that are pulling you into extension, which is usually the hips and the back extensors. If you're flexion related, you work on the muscles that are pulling you into flexion, which is the abdominals, hamstrings and glutes. All right, I hope that helps you. I'll see you on the next video.